Welcome back to the Nursing Post podcast, All Nursing All the Time with Ashley and Rosa. In this episode, we are going to discuss a news article that we read recently about patients' transplants being denied because of their unvaccinated status with COVID. Our goal is always to inform and to spark conversation.
Ashley and I did a few episodes on organ donation about a year ago, and we know that the number one organ needed the most for transplants are kidneys. And those needing transplants are on a waiting list that's about a mile plus long. Like it just keeps going and going and going. They're needed to the point where people are willing to receive them illegally on the black market. You know, when you're desperate and it's a matter of life or death, people do desperate things. So imagine waiting years on the transplant list and you're finally told you've got a match or it's time. And then you're turned around to hear the words that you're being denied or that you're no longer a candidate to receive that kidney or that heart, basically because you have refused to be vaccinated against COVID-19.
Again, like Rosa had said, we did go over transplants. It was episode 55 and 56. If you guys want to listen to those, you can. But 17 people die every day waiting on an organ. And every 9 minutes, another person is added to a transplant waiting list. Only 3 in 1,000 people die in a way that actually allow for organ donation. And one person can donate up to 8 life-saving organs. But as of January of last year, the total number of people that were waiting for an organ was 108,044. Of those, 91,354 were kidneys, 891 were for a pancreas. There are 1,688 that need both a pancreas and a kidney, 11,923 that need liver, 216 that need intestines, 3,500 for hearts, 968 for lungs, and then 43 that need both heart and lung transplant. So you can see that kidney is by far a mile away from everybody.
The highest need.
Yes.
Yeah, it's the highest need.
But nonetheless, even with some of these being lower numbers, they are individuals who are literally on death's door waiting for an organ. So that way
if they don't get it, they will die. That's point blank and simple.
Yes.
So there's an article, that we read. There's actually 2.
Mm-hmm.
One regarding the denial of a kidney transplant, which we got from the Washington Post.
Mm-hmm.
And then there was another article on a heart transplant that we got from ABC News. And both of these patients were on the list and both were denied. So we kind of wanted to talk about the patient's decisions as to why they decided not to vaccinate and the hospital's decision to not give them the organ based on the fact that they did not vaccinate.
Right.
Our kidney transplant, his name is Chad Carswell. He's 38 and he is from Hickory, North Carolina. And the reason why he made the decision to not get the transplant and not to get vaccinated was because he said it's about standing up for our rights and understanding that we have a choice.
Mm-hmm.
And he felt that, he knew by refusing to get vaccinated that the donor kidney that he needed so desperately, he wasn't going to receive it.
Right.
Period. He said he was willing to pretty much accept those consequences, even if it cost him his life. And he said to the Post that he was born free and he's going to die free. And that was his reasoning as to why he refused to be vaccinated and why he was denied ultimately his kidney transplant. He made that decision. He's mentally competent.
Yes.
And he knew the repercussions of the decision he made. So the other transplant was the heart transplant. And it was for a 31-year-old father who lives in Boston, Massachusetts. And his name is DJ Ferguson. And his mother is in this article pretty much pleading on his behalf as to why he didn't want to get the vaccination. It's not that DJ was against vaccinations, period. He's not an anti-vaxxer. He's gotten every last single one of the recommended vaccines, even down to the flu shot. So he's not an anti-vaxxer. His mother's like, that's not the issue whatsoever.
Correct.
The mother who's sitting here and advocating for DJ, she's a trained nurse.
Yes.
And so there were questions about not only him needing a heart transplant, but he also has AFib.
Mm-hmm.
And that there were concerns about some of the side effects that the COVID-19 vaccine may have because of that. And that we do remember in the beginning, there were very few that did have side effects from a particular injection, but it happened. And I believe one of those were clots. So like she's being the nurse that she's being is just like trying to make sure all, the T's are crossed and the I's are dotted and the periods are at the end of every sentence.
Right.
And so all she's asking for from the doctors was assurance. Like if he gets this vaccination,
can you assure me that he's
not going to die before he gets it, the transplant, and two, if he gets the transplant, that he's not going to die due to the vaccination and or be in a worse condition that he was before he went in. And because the doctors couldn't make that assurance, they went ahead and refused to vaccinate.
I love this article because when I read it, it was very informative, and it was kind of almost refreshing that, not to sound rude, but like there was a thought process. It wasn't just like, no, I'm not going to do it just because you want me to do it kind of thing. Like there's a thought process here. Like it's a legitimate concern. There was a little conversation about if he was to get vaccinated and get worse, if it would then make him ineligible to receive the organ because now he has some issue from the vaccination that was required for transplant, and now he can't get the transplant, not because he's not vaccinated, but because there's now a new issue that has to be sorted.
Absolutely. Like, and in this case,
it's a legitimate concern.
It's a legitimate concern, and kudos to DJ's mother because not just because she's a nurse, but because she was educated enough to know what to advocate for and how to advocate for it.
And if you think that the answer should be, oh, well, of course it's safe and it's effective and it's not going to be an issue and they should just get it, there's obviously something that's being missed. Because if the physician's not willing to do that, that speaks volumes.
That says a lot, doesn't it? Yeah, like like you said, it speaks volumes. So in both of these cases, the hospitals denied their transplants. In the case of the kidney transplant, Mr. Carswell, the hospital quoted that given the shortage of available organs, we do everything we can to ensure that a patient who receives a transplanted organ has the greatest chance of survival. It also cited guidance from the American Society of Transplant Surgeons and other organizations that recommend patients receive the coronavirus vaccines before undergoing transplants. So it is true, the vaccines have passed rigorous safety reviews and are effective in preventing serious illness and deaths. And the CDC, recommends anybody over the age of 5 to take the vaccine. Like, yes, we know to that regard that, it has passed safety reviews. However, in my opinion, because it's still such a new vaccine, we don't know what the long-term effects of that vaccine plus a booster are on a regular person, let alone a person who's receiving a transplant.
Right, because I'm sure patients that are on the transplant list or need a transplant are probably not involved in clinical trials.
Probably not. Probably not.
And I know that I'm going out on a limb there, but
probably not, because they can't put themselves in a predicament that would worsen their current condition.
Exactly.
You know, people think it's like super easy to be put on this transplant list, but it's not. There are certain criteria you have to meet. There are certain diets, certain weights, certain, vaccinations you have to have.
Yep.
And if you don't and are not compliant with the whole program, they take you off that list. And they'll do it in a heartbeat.
Fast, in a hurry. Yep.
Yes. So in the case of the heart transplant, the Boston Hospital pointed their response to their website that said that COVID-19 vaccines are just one of the several immunizations required by the U.S. transplant programs. And they mentioned, the flu shot, and they mentioned the hepatitis B vaccinations.
Yes.
And that hospital cited policies that require all transplant recipients to get vaccinated because the research has shown patients are at higher risk from dying from COVID-19, and that the mortality rate of transplant patients who contracted COVID at about 20 to 30%.
I completely understand that. I mean, I will say that some people are like, what? No, this is not new. They have always required vaccinations for transplants because
you get it. If you're in the medical field, we all understand how precious life is.
Yes.
Especially when you go back and you remember that one person can save 8 lives. That's a precious gift. Life is precious all in of itself.
Yes.
And, I understand the hospital when they're saying, we need to have the best outcome here. They're already immunocompromised. They're already taking medications that lower their immune systems. So we need to give them the best opportunity and the best chance to not reject whatever organ this is or have a serious complication. Like, I get that. So I can understand why the hospitals made the decisions that they made.
Yes, I would agree with that. That the hospital is going to stand behind the guidance that is set forth by places like the FDA, the CDC, where, hey, it's safe. We recommend it for patients who are immunocompromised. We know that transplant patients are because we actually put them on immunosuppressant medicines. So they're going to say, hey, this is what you need to do. And that's the only way to get on the wait list and be transplanted. But being the people that we are, Rose and I like to play devil's advocate.
This is true.
And we do this in like our day-to-day life. Like if I ask Rose a question or opinion, I'll be like, well, what about that? And she'll say, well, to play devil's advocate, which is her way of saying you really haven't thought about X, Y, Z, she'll give me a different perspective. And
my husband, you appreciate that.
I do.
But my husband hates it. He says that I try to argue with him on everything. And I'm like, no, I'm not trying to argue. I'm just trying to give you a different point of view.
Yeah. Well, and to me, that gives you the ability to make the best decisions. So like, I appreciate that. And I guess because we're similar in that, like, I understand, like, you're not trying to put a dig on me, but it is always nice because, when you come from different walks of life and you have different thought processes, then you approach things differently. And that's how you come up with this like great round table of people. Like, I've had this experience and they've had that experience and this one's had that experience. And then you all come together and you can really come up with like really great stuff. And that's how I feel about this. So I got to thinking, well, I can understand certain people's apprehension with this COVID vaccine. Now, Rose and I are firm believers in vaccinations. We're vaccinated.
Yep.
We both have had the COVID vaccine. Rose has had more than me. But
yeah,
it's one of those things that I trust the science enough that if I'm telling patients to get it, then it'd be kind of hypocritical for me not to have it. And I know that with the group of people that I work with, the more that I can protect myself and them, the better we all will be. So I am pro-vaccination. However, according to the CDC, it takes over 10 years to make one vaccine. And many references will tell you it's 10 to 15 years because there are multiple steps that are done to ensure safety. Now, Rose and I could go into a whole podcast on the 10-year process and how much of that is BS, paperwork, and red tape that should be eliminated. And we could also play devil's advocate to where that red tape is there for a reason. But that's not what we're here to discuss. The point is, it takes 10 to 15 years to get a vaccine.
Normally.
This whole thing didn't start until the end of 2019.
Correct.
Well, when it first came out, we didn't go, oh, we need a vaccine for that. That's not what happened. We were like, what the hell? Like, the whole world was caught, off guard, right?
Yeah.
And so it was months into the pandemic before people were like, we need a vaccine. Don't ask me the exact date. I don't know. And I didn't look it up. But nonetheless, this vaccine was done in record time, which is, to me, in a way, pretty awesome. I really think it's kind of cool. Exactly.
I do too, but it also makes you think, what other things are they sitting on that they could put out safely or rapidly?
What are we excluding? What are we getting rid of? What did we decide to cut to make this happen faster? You know what I'm saying? Part of that is long-term safety data. We didn't have a choice. I mean, I'm not bashing the FDA or the CDC. I am not. But we cut out the need for long-term safety data for approval to get this approved. Period. We don't know the long-term data because we don't have any. Because long-term data takes time. And nobody can make that time go faster.
Absolutely not.
It's just not going to happen.
What, two and a half years?
Since the whole thing started.
Yeah, from the jump.
So we've been, what? How long has the vaccine been out?
I want to say
a year and a half-ish?
Yes. January, I think healthcare workers were getting them in December of 2020 and January of 2021. So
it took about a year for us to come up with a vaccine. It took a year for us to find out what this thing is, try to figure it out just within a healthcare standpoint, then realize we need a vaccine and then get a vaccine up and going. I think really, if you were probably to look at it, I would estimate it was probably about 6 months for we need a vaccine to where we have a vaccine.
Absolutely. I think they were probably working on the vaccine right in the beginning when people were trying to compare it to the flu. They're like, oh, we already have a baseline.
Well,
it's in the same family.
Right. And I do understand that this wasn't made from scratch. I get that. But it still not make a damn bit of difference that the average vaccine takes over 10 years and we did it in 6 months.
Okay.
So these doctors cannot assure, no doctor is going to tell you should get the vaccine and I'll sign off that you'll be okay. They're not going to do it because they can't say that because they don't have any data to back up that.
Well, it was just like in the beginning, we worked at Pulmonary. How many patients called and were asking for doctor's notes in order to not go to work because they didn't want to be exposed because they supposedly were being seen by a pulmonist and felt like because they had a pulmonary condition that they shouldn't have to be exposed to it or go to work.
Yeah, it was a massive amount of calls. I'll leave it at that. It was ridiculous. And it was very overwhelming, but nobody knew what was going on. I mean, when we first came out, it was like, oh, you don't need to wear a mask. And it was like, you need to wear a mask. And then you don't need to wear a mask. And now we're back to wearing a mask, but now we might be getting rid of the mask again. So, and you wonder why people are non-compliant. And I understand, like, from a nursing perspective, I go, well, we're still learning. We're still learning. And as we learn new things, data changes. That is fine. That's how shit works. But you can't blame people for not trusting you, because what we know now and what we knew then are different. So we're suggesting different things. So how are you going to get mad at anybody for not listening to you because you really don't know what you're talking about?
Yeah,
because it's brand new.
No, I definitely agree. From Jump Street, this whole situation, the pandemic, the precautions, the vaccinations, I think the misinformation, I think all of it from Jump Street was, a shit show.
Yeah, that's a nice way to put it.
It was a hot damn mess. It was a shit show, and nobody knew their left from their right.
I still don't think we do sometimes. And so I will get a little irritated when they'll say things like, well, they have to have the flu shot, and they have to have the Hep B shot, and they have to have the shingle shot. You are not comparing apples to apples.
Apples to oranges.
Yeah. I mean, they're both vaccines, but it is, in 10 years, like Rosa says, when you have the lawyer on the TV going, if you took the COVID injection, you may be entitled for, like, I legit, like, something's probably going to come up. Like, something's probably going to come up. Like, I'm not necessarily surprised. Did it stop me from getting it? No. Do I think the benefits outweigh the risk for me personally? Yes. I do. But to deny somebody a transplant when you can't guarantee that that's in their best health, that's pretty ballsy.
It's something to be said, because it wasn't until a recent episode that I even learned about the hospital and the FDA's ability, for what's it called? Compassionate.
Oh, the compassion use? Yeah.
Yes, compassion use, where basically you're stating, like, 99% this isn't going to work, but we're still going to do it, and you realize the risks of doing it. But then at the end of even that, let's say you go through that compassion process and you're still denied. At the end of the day, it is the decision of those people on that committee in that hospital that make the decision as to whether or not that patient will receive a transplant.
Yeah.
Of course, there are recommendations, there are guidelines. I mean, for Pete's sakes, you get that with everything you order. A $5 toy to
that's so true.
To a $1,000 computer. Yep. They're always giving you guidelines and instructions.
Yep.
But at the end of the day, the hospital holds that, unfortunately, power in their hands. They can either say yes or they can say no.
Or no, exactly. And it's kind of sad when you think about it. Like, just because somebody doesn't agree with you, they can just say no. Like, I don't know. It's hard for me because I am pro-vaccine to argue, like, yeah, you probably shouldn't get it. But I know that I could not look a person in the face and say, yeah, get the vaccine. Nothing's going to happen to you with 100% certainty.
Well, there's nothing that's 100% in medicine. Nothing's 100% ever.
Well, right. But I mean, I can pretty much say the likelihood of you having a terrible adverse reaction and dying from the flu shot is like point something percent. Versus with the COVID vaccine, there's a lot of people that have been adversely affected.
This is true. And at the end of the day, is it a political statement or a personal preference?
Well, and to me, I'll say this. Like the guy with the kidney, to me, that's a political statement. I was born free and going to die free. That, to me, that's politics.
I agree.
But with this other guy who is 31 years old, has a heart arrhythmia, and says, all I want is something, I want you to look at me in my face and assure me that if he gets this vaccine, he's not going to have a worse issue. And they can't do that.
That's true.
That is not a political statement. That's I want to give the best possible care to my child.
That's a patient advocating for him or herself
Mm-hmm.
who has all the right to do so.
Yes.
And as a human, I really wish that everybody that was on the organ transplant list was able to find their transplant replacement.
Oh,
I
yeah.
mean, nobody wants to be on the list in the first place, and then
No.
to be told no because you're refusing to get a questionable vaccine that nobody knows with 100%, 95%, 80% certainty of anything.
Mm-hmm.
You know, I understand. I can understand the hospital side. I can understand the patient side. Like you said, I see where one is political and one is literally self-preservation,
right,
and personal.
Mm-hmm.
Maybe with GMO organs, everybody can get one. You know what I'm saying?
Right.
You never know with that either. But what I do know is, as a nurse, I understand why the hospitals made their choices. Politics aside, the requirement of the vaccinations for those receiving organs existed before COVID-19, and it's vaccinations and boosters. Get it. You still have to take the flu shot. You still have to take, the Hep shot. You still have to take the Shingles shot. You still have to follow the certain criteria.
Mm-hmm.
And this vaccination, unfortunately, is not any different than the requirements that they have already made.
Yep.
So I hope that these patients have really thought through their decisions and are 100% okay with the decisions that they've made, because it really is for them a matter of life or death.
You can visit us on our website, thenursingpostpodcast.com, to see our show notes with our references there. We also have merch now on our website as well. You can subscribe to our podcast on your favorite platform, where you can, of course, share your thoughts on today's episode. And thank you again for listening to